You're listening to the BBM Global Network with 25 years in broadcast audio and video production. Our passionate team creates content and marketing for the world of Internet Talk Radio. If you've got a passion, come join us at bbmglobalnetwork.com. The BBM Global Network. Your voice is now heard.
A mind is a terrible thing to waste. Welcome to EnterConnected with your host, Dr. Raina Gilmore. Psychiatrist Raina Gilmore will explore the interconnectivity of the mind, body, soul, and spirit, and how they have an effect on each other within our internal and external worlds. So welcome the host of EnterConnected, Dr. Raina Gilmore.
Hey guys, I'm Dr. Raina Gilmore, and you are listening to EnterConnected. We're on the BBM Global Network and TuneIn Radio. I welcome you to enter on this journey with me as I explore the interconnectivity of the mind, body, soul, and spirit. When you enter this space, you will be connected to a wealth of information. You will also realize that we are more alike than we are different, so we should use that to lift each other up as opposed to tearing each other down. If anyone has any questions, the phone number to call in is 866-451-1451. Again, that is 866-451-1451. So with it being August, and actually we're ending August, I can't believe it. Time is going by so fast. But today is actually National Women's Equality Day. And this month is Black Business Month, Happiness Happens Month, National Wellness Month, as well as Romance Awareness Month, among a whole bunch of other things. So I have the pleasure of having special guest, my line sister, Dr. Soyini Hawkins. Dr. Soyini Hawkins is a board-certified, fellowship-trained, minimally invasive gynecologic surgeon. Try to say that 5 times fast. She is a provider at Fibroid and Pelvic Wellness Center of Georgia in Alpharetta, Georgia. She provides specialized surgical management of abnormal uterine bleeding, pelvic pain, and most benign gynecologic conditions. She's also active in her church and community as a member of several societies and a participator in numerous outreach endeavors. She's also a beloved member of Delta Sigma Theta Sorority Incorporated. As a fibroid and endometriosis conqueror herself, she is passionate about educating, advocating, and treating fibroid and endometriosis sufferers. She feels her wellness journey is a true testament to life beyond these ailments and encourages all women to live their best healthy life. So who runs the world, girls? Thank you. I'll probably sing a little bit later. You already know. But without further ado, Soyini knows me very well. Without further ado, I introduce Dr. Soyini Hawkins. How you doing this evening?
I am so good. Thank you for having me. Oh my goodness, yes. I'm super excited about this.
I'm excited too. Oh my gosh. And I didn't even realize it was National Women's Equality Day. It's like it's perfect. So there's without Black Business Month, with National Wellness, Romance Awareness. Right. All of that goes into what we're going to be talking about. So it's right on time. It's definitely right on time. And we need some happiness right about now. It's just too much going on out there. So let's talk about, we talk about the issues, but we can also try to maintain some kind of joy in the midst of all of this sorrow. So can you give a little background about yourself?
Yes, absolutely. So Raina and I go way back to our college days. We both attended Xavier University of Louisiana together, and we did also pledged the same sorority, and we were line sisters and really good friends even before that and well beyond that. Really, we could probably tell good stories about our times together, couldn't we?
Oh, yeah. Yes, we could.
And
Yes, we could.
if anybody knows anything about Xavier University, they put out the most African American physicians in the nation. And so both of us, found our paths into medicine. And I am now a practicing gynecologist, as Raina said, and I definitely have a somewhat of a niche in my practice now, and I take care of a lot of complex surgical patients, in which for most women that falls into the categories of abnormalities in their menstruation, which can come from fibroids, or pelvic pain, which can come from endometriosis, and a host of other issues. But I spent my last few years of training actually learning how to really hone in on good surgical skills and learn how to be a robotic and laparoscopic surgery. So my heart, when it comes to my work heart is in the OR. I really, really enjoy doing surgery.
Okay, so OR being operating room for those who don't know, you have this medical jargon. And so what led you? I saw in your bio that you dealt with some issues with endometriosis and things like that. So what led you even before that? That probably is what led you to specialize, but what led you to go into not medicine, because Xavier just kind of pushes that on you, but into OBGYN specifically.
Yeah, so women's health, I think I've always been drawn to wanting to do something a bit closer to women's health, even before Xavier, before college, when I realized I wanted to be a physician. I think it's probably because naturally that was what the example was that was around me. I went to a gynecologist and my pediatrician was a woman, and it just felt like that was probably the natural route to go. And I was like, oh, I can deliver babies, which I haven't done in 8 years. So I let that dream go a long time ago. I don't deliver babies anymore. But going into women's health for me actually fit. Even when I started to kind of explore everything, it still fit because I got a little bit of primary care. I could help women be healthier, but I also had a continuity of care, and I also was able to use my hands to do something. And like I said, I think I definitely took on to procedural and operation and surgery. So I felt like OBGYN, I got the best of both worlds.
Okay. And you haven't looked back.
And I haven't looked back. I dropped the baby thing because
you didn't drop any babies, right?
I didn't drop the baby.
Oh, okay.
I just dropped the delivering the baby.
Because you dropped some babies. Now I'm not.
that could have done it too.
Right. Yeah. But so what made you want to specialize in what you specialize in and not deliver?
Actually, my journey. So I definitely felt OR inclined early on. And in my second year of residency, right before I started residency, I was diagnosed with fibroids. And it was a surprise diagnosis, meaning that I didn't have any symptoms whatsoever. I had a little bit of pain one day and went to the doctor, and they're like, oh, you got fibroids. And they were 18 centimeters. I was almost 5 months pregnant. Didn't know it. I could have been on the show pregnant and not know it.
Yeah, right.
Right. And then I struggled with it and became very symptomatic. And I don't know if that was just a mental thing. Now I know I have them. They began to bother me. Isn't that crazy?
Right.
How
the
anxiety behind that diagnosis brought on the symptoms. And I mean, they rushed on. My first year residency, I suffered. I don't know who's listening in the audience and they want to hear all these details, but I suffered. And I worked 100-hour weeks with a hemoglobin of a third of what it should be. My blood count was so low and I was so drained and it took a lot out of me. And then I decided enough was enough, and I had surgery during my second year. I got married, and I had surgery during my second year of residency. And then, yes, I know. And then by the time I got to the end, my fourth year, I had a pregnancy and my first child. So it was a whirlwind. But that experience of having to deal with the fibroids, and I actually was diagnosed with endometriosis during my surgery. My surgeon told me I had stage 4 endo, was what made me decide, okay, this is my ministry. This is my calling. This is what I already wanted to be in the operating room, and this fits a purpose for me. It felt very purpose-driven to kind of zone in on that. And I actually went back and learned minimally invasive surgery from the surgeon who did my surgery. I literally went to him and said, teach me
Full
everything
circle.
you know. Yep. Full circle.
Full circle. Yeah, that's a wonderful story. I think a lot of times we go into something, we have some kind of personal connection to what we go into. There, everything happens for a reason, and I think we put a lot of ourselves or people that we know into our careers, because that definitely is what led me to go into psychiatry. So and I'm very proud of you. I remember those stories back in the day. We might still have one of your boxes in my garage from when we did that one program, but we don't even live in that house no more. But yeah, no, I mean, we go way back, and I like to uplift people because there's so many of us out here, especially women, especially Black women, just tearing each other down and stuff. So, I like to promote positivity and let people know who's out there, because there's a lot of women out there that are struggling and that they don't know the questions to ask. They don't take care of themselves because they're always the caretakers. And so I think it's very important, to have this discussion. It's time for us to take a break.
That.
Yeah, we will. I'm Dr. Raina Gilmore, and you're listening to EnterConnected. We're coming to you live from the BBM Global Network and TuneIn Radio. And when we come back, we are going to talk about women's mental health. We'll be right back.
Have you ever felt like no one is listening, or you're not getting the honest attention you deserve? Do you even know the kind of attention you want or need? You are not alone. Alice Aspen March is here to help. Thanks to Alice, through her epiphany and research over the word attention, there are solutions to the attention dilemma. Worldwide audiences have been enthralled and engaged for over 40 years with her visionary and pioneering observations. The kind of attention we get and give is vital to improving our lives and society. Alice and her weekly guests review game-changing insights for transforming and improving our understanding of attention, providing techniques for creating healthier and empowering behavior. Get a new perspective on a mainstream word. Tune into Why Our Attention Matters for fresh and thought-provoking conversations every Tuesday at 3 p.m. Eastern on boldbravemedia.com and the TuneIn Radio app.
Hello, welcome everyone. I'm your host, Dr. Raina Gilmore, and this is EnterConnected. We're on the BBM Global Network and TuneIn Radio. If anyone has any questions, the phone number to call in is 866-451-1451. Again, that is 866-451-1451. I neglected to introduce myself in the last segment for any first-time listeners. My name is Dr. Raina Gilmore. I am a psychiatrist that specializes in child and adolescent psychiatry. I'm from Florida and currently practicing in Cincinnati, Ohio. This evening, we're celebrating women and Black businesses and happiness and wellness and just women's health. This is what we're talking about. Mental, physical, spiritual, all of it's connected. So we're talking about that. And, I'm feeling good. So I have a song, it's a new dawn. It's a new day. It's a new life. And I'm feeling good. Thank you. So this evening, I have the pleasure of having special guest, my line sister and friend, Dr. Soyini Hawkins, who is a board-certified, fellowship-trained, minimally invasive gynecologic surgeon. So I want to talk about mental health. You talked about, the anxieties that you were having as you were dealing with your own personal struggles with endometriosis and fibroids. So can you talk some about kind of the connection with the mental health as it relates to the women that you work with?
Absolutely. I mean, it's a huge connection, and it's one that I think is undervalued, and it's not talked about at the forefront of when we make these diagnoses. We're so clinical, right? We're so focused on what does the ultrasound show, or what do the lab results show, or what is going to be, my approach from surgery. But one thing I try my best to not neglect in discussing with my patients, especially because, like I said, the patients that find me and are coming to me have been on a journey. Like they've literally been to their wits' end with whatever it is their diagnosis is. And I don't want to ignore, I don't want to ignore the emotional and the mental part of that, because a lot of what goes into, honestly, just surviving and getting to the other side of a lot of ailments for women is how they're able to cope through it. And the coping can't come if you don't have a good, at least you put yourself in a good mental place about whatever it is that you're going through. So, I mean, I'm so happy that you were even willing to bring this into the discussion. Sometimes when I talk medicine and, like you were saying, that get all the jargon into it, the reality around how stress impacts us in our womb and how stress impacts us in our pain and just, our outlook on how our health is, we don't have that discussion enough. We don't.
Nope, we definitely
Super valuable,
don't.
Though.
Yeah, it is. And I appreciate you talking about it and kind of reiterating that, because, the mental health is involved in every job. You get I think many, not just medicine, but in every job. And I think that many times we are, kind of shunned or made fun of or seen as fake doctors or whatever. I've heard so many different things. It's, they call us shrinks, for goodness sake. Right. So, but mental health is so important,
Absolutely.
And especially when you're dealing with illness, any kind of illness, you're going to get stressed. And then the stress of this world, okay, just the stress of your own world, and then when you add on top of that all of the stuff that's going on in this world, that adds to that. And then there's a lot of miseducation or lack of education, lack of health education. Like I was saying, women are taking care of everybody else all the time, so we often put ourselves last, but we should put ourselves first. It's easier said than done. But we should put ourselves first, because then people say that's selfish. Like they're like, oh, that's being selfish if you put yourself first. But it's actually not, because an optimal you, right, is going to be an optimal person for everybody that you're taking care of. Because when you out for the count, right, when you out for the count, then everybody suffers.
I say it all the time, because many women, they'll come to me and they've been, like I said, I suffered for a year. And I think I was putting my career in front of my actual health. And for many women, they're putting either their family or their career, it could be the same scenario, or their children or their husbands. I have women recently that I diagnosed with cancer who knew she was symptomatic and had been symptomatic for a couple of years, but her husband also was recently diagnosed with prostate cancer. And her entire focus was on her husband. And I think, honestly, and again, we're talking about mental health. I literally think she compartmentalized her symptoms, and she was able to just put it in the back of her brain, put it in the back of her, even, what she actually probably was suffering or feeling from it. She was able to almost numb herself so she could take care of her husband. And by the time her husband had gotten better, or she had gotten into a place of where she was comfortable with him being, she said, okay, now it's my turn. And here it is, I'm making this diagnosis for her. And I forced her to kind of think about, when did these symptoms actually begin? Because when she walked in the door, she said, it's only been going on for a month. And I looked at her and I said, no. When did these symptoms actually begin? Right.
Yeah.
But we will do that. We will do that. And sometimes to our detriment. I 100% agree with you that, especially because we are the matriarch. I mean, it's called matriarch for a reason. We're the matriarch of our household. We kind of are somewhat of the foundation a lot of time for our families, even in our jobs. I mean, women run the world. They made that song up for a reason. That might be a next song for the segment.
Okay, I'll do it.
We're looked to. I love it. We're looked to be strong. Period.
Yeah. Absolutely. It's time for us to take a break. I'm Dr. Raina Gilmore, and you are listening to Interconnected. We're coming to you live from the BBM Global Network and TuneIn Radio. And when we come back, we are going to talk about women's medical issues and taking care of ourselves. We'll be right back.
Do you want to remove unconscious beliefs, programs, and energy quickly? Are you looking to actively receive messages, activations, initiations, and gifts from your higher self? If so, tune in to A Call to Heal, a show that begins with a channeled, guided meditation for expansion and upliftment. Listen to Carolee and Julia deliver intuitive messages and energies. These powerful readings affect the energy bodies of all who listen. A Call to Heal radically helps those who listen to integrate their shadow and consciously expand their light body. Don't miss your opportunity to call in and facilitate a healing for yourself and the world. Listen to A Call to Heal, Monday nights on the BBM Global Network. Be the change you wish to see and make your call to heal.
Have you ever wondered why some children recover from their symptoms of autism while others never seem to get any better? After 13 years of research, Karen Thomas has recovered her own son from his symptoms of autism naturally. She now shares how she did it with you in her free webinar so that you can have the right resources and knowledge to help your child. The definition of recovery is to regain health. Karen offers this to you in 4 stages: healing the gut, natural heavy metal detoxification, balancing the co-infections of autism, brain support, and repair. Register now for this free webinar to help you know what you can do to help your child to sleep better, be more calm, improve focus, and reach their fullest potential to live a happy, healthy life. Go to naturallyrecovering.com/free workshop, empowering parents with the resources to naturally recover autism from a mom who's done it.
You are listening to Interconnected, and I'm your host, Dr. Raina Gilmore. We're on the BBM Global Network and TuneIn Radio. If anyone has any questions, the phone number to call in is 866-451-1451. Again, that is 866-451-1451. This evening, we are talking about women's health, and women run the world. Now, who run the world? Girls. Who run the world? Girls. Okay. That's the song for this segment. I have to come up with one for the next segment. But people always talk about like having, balls of steel and pull from your gut and all that. You know what? If as women, we have vaginas of steel. Okay. Do you know how much stuff the vagina has to go through? And it just continues to do its job. You know what I'm saying? I mean, it just keeps going, But we shouldn't pull from our gut. Then we should pull from our vaginas as women. That's all I got. Okay? I just needed to say that. I needed to get that out. It was coming from my spirit.
I love that. Mm-hmm. I love that. As a gynecologist, I love it.
Yes.
You might have to make a poster,
t-shirt.
A billboard.
It's going to be a t-shirt.
PSA. Yes, yeah, I love
PSA.
it.
Pull from your vagina. Vaginas of steel. Okay. All right. Nobody take that, because if you do, I'm suing. Okay? My father's an attorney. Great. So I want to talk about, lots of women actually have fibroids, undiagnosed, and endometriosis and heavy periods and things like that. And so what kind of advice do you have for women as far as taking care of their health, just general health, as well as gynecological health?
Well, I mean, in general, I want women to be very much more just in tune with their bodies and what just doesn't feel right. Because I think that we all have this sixth sense of when something just isn't right. Sometimes we're shy to speak up or say something. We don't want to make a big deal about nothing to do, right? We don't want to call out for help, and it's something we could have taken care of ourselves. But the unfortunate thing is that will lead a lot of times to delayed diagnosis or misdiagnosis or misinterpretation of the symptoms. You kind of go in and you're like, it's not that bad. It hurts, but I'm tough. I got a high pain tolerance. I hear it at least 10 times a day. Right? Or we're not keeping track of the subtle things. And I don't want anybody to become a hypochondriac and feel like, oh my God, that gas that's just gas. It's not, it's not the end of the world. It's just gas. But at the same time, if you're bleeding heavily and you're missing days of work or missing school, or your pain is so excruciating that Advil or Midol just isn't touching it and you can't get out of the bed, you're incapacitated, that is not normal, right? So I want us to stop normalizing pain as women and suffering as women, because we're going to call it what it is suffering, and stop normalizing it as if it's something we just have to deal with and something we just have to go through as women. I hear that way too much as well. And, the next step after that is advocating for ourselves. So when we do go to the doctor and we say, okay, I think this is going on, I'm concerned about it, is it normal? It's not okay, or it's not good enough for the doctor to say, okay, it's not a big deal. Or secondly, for the doctor to say, okay, try this medicine, and not actually investigate what is going on. If you're having heavy bleeding and pelvic pain, your doctor should be doing an ultrasound. Period. Point blank. You know what I'm saying? I was not diagnosed, and my uterus was almost 3 times bigger than it should be. Right? And I was going to the doctor. I was getting my physical exam. So what was the excuse? They missed it. So it's very imperative that we as physicians do well and do right by our patients, but us as individuals must be our best advocates. Just like we'd be our best advocates for our children, we have to be our best advocates for ourselves as well. Very important.
Yes, and be examples for, the children as well. Because if children see that we're taking care of ourselves and doing what we need to do, then they will learn, things to look at and signs and all of that. Because there's things that happen in your teenage years. I've got patients who talk about having, heavy periods and things like that. And, and I'm just like, a lot of these things you think it just happens to adults. But, I'm like, no, you get that checked out like now. Like if you are, having low energy and dizzy and you're anemic and stuff, like, especially as women, if they're anemic, like you need to, it's not just because you have a period. Yes, we generally will have, a lower blood count because of the fact that we, have menstrual cycles. But now, come on. Yeah. You still got to, do your breast exams, do you mean, and don't let somebody else do the breast exam. See, because that's just them trying to be freaky. This is what I'm talking about. See, don't. You do it yourself. You need
Raina, you know how many? I have actually had 2 women diagnosed with breast cancer because their partner found the lump.
Okay, I'm not saying.
So don't miss the opportunity.
Okay,
either.
I'm not saying like men. I'm not saying don't touch the breast. You can do that, and I think that's great. But women need to be more proactive in doing that as well. But yes, I know. I think I talked to somebody else who was telling me that, actually there are a lot of men that, find a lump before a woman does. And I was like, oh, yeah, well, I guess I can see. Yeah. No, but I can see how that happens because, women aren't really thinking about that. But
you're right. 100%. Because I will say that I'm even guilty of that. Every once in a while I'm like, ooh, maybe I need to do a breast exam. But you know how we reminders that we used to give women in OB when I was doing obstetrics and gynecology and doing more women all the time. We used to give them these little things to hang up in their shower to try to remind them to do them. And it's, we forget to do it. But you're right. We need to get back to that. Yeah. We need to get back to a vigilance about our health. Yeah, for sure. While we're worried about, wiping the behinds of the babies, we need to make sure that we're doing our checks and taking care of ourselves too.
Wipe your own behinds. You got to put your mask on first, right? So check them breasts
put your mask
before you worry about changing that diaper. You know what I'm saying? Change the diaper. Now, I don't want the baby to have diaper rash, but I'm just saying you do have to do your breast checks because, at the end of the day, if we don't take care of ourselves, nobody else will. Like a closed mouth is not going to get fed. So if you have this stuff going on and you're not saying anything about it, then it could be too late. So that's the real about it. It's time for us to take a break. I'm Dr. Raina Gilmore, and you're listening to Interconnected, coming to you live from the BBM Global Network and TuneIn Radio. And when we come back, we're going to continue to talk about women's health. Stay tuned.
Mike Zorek, a three-time California state champion in Greco-Roman wrestling at 114 pounds. Mike, blind since birth, was born in Hartford, Connecticut. He was a six-time national placer, including 2 seconds, 2/3, and 2/4. He also won the Veterans Folk-Style Wrestling twice at 152 pounds. In all these tournaments, he was the only blind competitor. Nancy Zorek, a creative spirit whose talents have taken her to the stage and into galleries and exhibitions in several states. Her father, a commercial artist who shared his instruments with his daughter and helped her fine-tune her natural abilities, influenced her decision to follow in his footsteps. Ms. Zorek has enjoyed a fruitful career doing what she loves. Listen Saturday mornings at 12 Eastern for the Nancy and Mike Show for heartwarming stories and interesting talk on the BBM Global Network. What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense Radio Show with host Dr. Broderick, Wednesdays 7 p.m. Eastern on the Bold Brave Media Network and TuneIn Radio. And to help support the Broderick Foundation, please go to EasySense.com and learn how, with your help, we can fight these horrific brain disorders. That's EasySense.com to learn more and help support the Broderick Foundation.
Hey guys, I'm Dr. Raina Gilmore, and you're listening to Interconnected. We're on the BBM Global Network and TuneIn Radio. If anyone has any questions, the phone number to call in is 866-451-1451. Again, that is 866-451-1451. This evening, we are talking about women's health and, ooh, ladies first, okay, all right. And I have the pleasure of having Dr. Soyini Hawkins, who is a board-certified, fellowship-trained, minimally invasive gynecologic surgeon. Pull from the vagina. Great. All right. So I would like to, yes, vaginas of steel. I would like to talk about spirituality. You talked about, I think you touched upon your faith and like in the introduction. So how do you think spirituality fits into what you do?
Yeah, it honestly, for a lot of women, is defined very differently, which I completely and utterly respect. And I definitely know that in medicine, I think just period in our culture, and then also even if you think about historically in medicine, spirituality has a place, and it fits for a lot of people because especially when they're getting either a diagnosis or they're trying to get through a turbulent time with their health. A lot of women will turn to their spirituality to literally help them get through, literally get them into either the right headspace, tying into what we talked about in the last segment, or to help them to just sit on faith for either a cure or faith for direction. I tell in my consultations with a lot of patients, especially if I could get that vibe that they're faith-based, by giving them all the options and telling them, you don't have to decide today. Go pray about it. Like literally, go pray about it. Go, have this discussion with your family, your friends. Google it. I don't mind. But if you feel fit to, go pray about it because, for me, I'm a Christian and I strongly believe in God and my faith lays in that. And for me, he makes things very, very clear. When I have decisions to make about myself, my household, my family, work, I pray about it and he makes it very clear. So that works for me. So for a lot of women, their spirituality ties into getting them through it, and then also helping them figure out that pathway, to make the next move or decision when it comes to their health. The important thing I always also reiterate to women and to families is that you don't stop there. You don't pray and then just stop there.
And that's it.
You pray and you pray and you have to listen and you have to be obedient. So if you're diabetic and you can't pray over the chocolate cake that it ain't going to increase your blood sugar. You know that chocolate cake is going to increase your blood sugar. You know what I'm saying? I mean, the Lord works miracles. It's got to be real.
You got to be realistic.
Right? Unless you made it with the almond flour and with, maybe a little bit of maple syrup instead of the good old cane sugar.
It's still going to increase your blood sugar. Okay.
Yeah, you're right. That glycemic index. Yes, you're correct. Mm-hmm. I was just trying to help them out a little bit.
This is your world. I'm just saying.
You make it a nice little keto diet or something.
Right.
You have to make the conscious effort, even within your spirituality, to just do better for your health. It takes work. Yeah. It takes work. Even in the diagnosis of finding out that you have something. And the reason I think it's so important is because sometimes when you get the diagnosis, especially for fibroids, I'll say that even very specifically, it's easy enough to get complacent. And I purposely use that word and get comfortable and say, okay, this is, it's not a big deal. It's not bothering me. I'm going to ignore it. But when you get the diagnosis, thank God for it, and stay vigilant. Like, keep an eye on things, keep an eye on your health, keep an eye on the fibroids, because 1 year it might be fine, and 5 years from now you might be talking about a pretty significant intervention that needs to be done. And for some women, prayerfully, not anyone that's listening, because it might be a little bit triggering, but some women lose their options for fertility in that journey as well, which is, really, really sad. But our spirituality definitely teaches us to, do what we have to do to get the diagnosis, understand it, educate ourselves, pray about it, and then be vigilant. Do something. If there's something to be done, do it.
Okay. How has COVID-19 affected your practice?
I would say in March it affected it greatly, and I actually transitioned. I think we talked about this too. I transitioned during COVID-19, so it was definitely very traumatic at the beginning. I actually was let go from my position, and thank God I had already had in the works a plan to move. A plan to transition my practice to mine, like 100% mine, moving in location, everything but the name, everything but my identity and the name of my practice, because that's where, that's kind of where I have my following. And I was able to do that. In COVID, I was able to do it. I talked to the right people. I had already had plans in the works. I just executed like a rush, like what was going to happen in 6 months. I was like, no, we got 30 days. Let's make it happen.
Got to put a little fire under you. We're like, okay, well, no, we're going to do this now.
It did. So COVID came down in March, and by July 1st, I opened my own practice. I literally opened the doors to my own brand new practice, which I wasn't anticipating and happened until December. So COVID for me had a lot of rough moments, but hidden in there was a blessing for me. Mm-hmm. Hidden in there was a blessing that it just propelled me into what my plans were, for my true 2020 plans were, and I'm excited for it. Since I've been back in the operating room, I went back in the operating room, I think around May and June, and they were good months for me because so many women had to wait and be, kind of had their plans put on pause because of COVID. So May and June were really, really good months for me, and it's been fine it's been fine since. Even in opening my doors in July, because May and June, I still did everything virtually. And I planned around that, and patients were very, very, very accommodating to make sure that we still kind of kept things moving. And then when I opened the doors in July, it was almost like, nothing had ever happened to my practice. It was good.
All right. Awesome. Finding a blessing in the storm. I love it. Congratulations.
Yes.
Congratulations.
Thank you. Thank you.
It's time for us to take a break. I'm Dr. Raina Gilmore, and you are listening to EnterConnected. We're coming to you live from the BBM Global Network and TuneIn Radio. And when we come back, we are going to continue to talk about women's health. Stay tuned.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
Tune into It's All About You with host Dr. Martha Latz, a lively weekly broadcast on BBM Global Network, one of the most empowering shows for time-starved, overscheduled multitaskers. The professional expertise of Dr. Latz is directly available live every Thursday at 1 p.m. to answer and address concerns about relationships, life transitions of career, meeting, dating, and committed relationships. It's All About You with Dr. Latz will expand your understanding of current concerns across your relationships by broadening and expanding possible solutions in developing skills for mutually desired outcomes. Dr. Martha's expertise is as a licensed marriage and family therapist, life, transition coach, and all things to do with communication at work, home, and with friends. Check out her website at auniquetherapycenter.com.
Hello, welcome everyone. I'm your host, Dr. Raina Gilmore, and this is EnterConnected. We're on the BBM Global Network and TuneIn Radio, and tonight is Ladies' Night, okay? Well, this is Ladies' Night, and I'm feeling right. Well, this is Ladies' Night, oh, what a night. Okay, so we're talking about women's health. And I have the pleasure of having special guests, my line sister, Dr. Soyini Hawkins, who is a board-certified, fellowship-trained, minimally invasive gynecologic surgeon. And we've been talking about women's health, all the aspects of women's health and the importance of that. And I want to talk, so we talked about spirituality in the last segment, and I wanted to talk about, you said you just opened a practice, you're a mother, you're a wife, you're a professional. Like, how do you find harmony and balance with all of this stuff that's going on? And what do you tell your patients?
Still working on that. So that's super, super important. I think me working on that is first, being able to come to the realization that I can do better. There's room for improvement in finding that balance. I want to say that I'm in a season where I'm super, super busy and focused on work because I opened up a practice. It's almost like a baby, right? It's almost like giving birth. I am I was in a totally nesting phase before July, and now I'm in this new baby, smells good, and I just want to dress it in pretty clothes and type of season. And then after a while, I'm gonna not care if the wipes are warm. You know what I mean?
Right.
Okay, just don't do it. You don't need it heated up. Just do it. Just get a baby a bottle.
Right.
So when I
get that rag over there and wipe it up. Right.
Wipe it up. Right. When I get back into that part, I think I'll be able to shift back into a better balance. Because I think before COVID, I had a better balance about my life and my children. And then, Raina, the whole twist that COVID has put on, even inside of my house, the digital learning.
I'm sure.
My children are not back in school. They're home. The computers are on my dining room table. So on top of spending a lot of hours doing work and promoting myself and kind of babying that, I come home and even what I used to be comfortable with is not the same. So I'm praying that in the next couple of months, I'm going to get that balance back. But it's super, super important. I mean, my husband and I celebrated our 11th wedding anniversary this weekend, and he took me away. And he took me away and was like, no laptop. I had to leave my laptop.
Did you have...
I've been separated from my laptop for 24 hours in
the
last 5 years.
I know that's
Even on
tough.
Vacation, I take my laptop.
Me too. Me too. I may not take it out the bag at the vacation, but usually at some point I take it out. Because people are.
I do. But you're right. Balance is so important.
Yeah, it definitely is. And I learned later in life about meditation and how much power that can have just in how you respond to your day, because I work at 4 different places, so it's hard to navigate that. So I definitely get it. So you're in Gwinnett County, correct?
I am.
Okay, so talk to me about.
I didn't know that. Oh my gosh, you're so good.
You told me.
Yeah.
Okay. But, right. Tell me about this whole COVID situation, and then the moms protesting and stuff like that. What?
Yes. Oh, yes. I forgot we had that conversation. Yes, because you asked me about the plans for the children in school.
I was concerned.
Yeah, Gwinnett. So Gwinnett actually was one of the counties in Georgia. And Georgia, unbeknownst to a lot of people, is very, it feels like, I don't even know what the right words are to use because I don't want to be political at all. It's not, we're progressive in Atlanta, but it's very much a,
conservative.
Okay, I'm not going to cover it.
It's
I
conservative.
Just call it conservative, but it is. It's a lot of rural areas, and it is a conservative state. And so there was, in some places, a big push to just get back to life, open up the economy, get the children back in school. Like, what are y'all talking about? Do we even need masks? Whatever. Gwinnett was not of that. Gwinnett was not of that same philosophy initially because of the numbers and the second surge, which actually wasn't a second surge. It was just the first one rising to a peak because we didn't, do perfectly when we had the opportunity to, right? And Gwinnett said, no, we're shutting the schools down. The children are not coming back. Everybody's doing digital learning. But what happened with that is that a lot of families and parents felt, okay, you guys gave us an option. We chose an option, and now you're ignoring our option. Because about 50% of the parents, when they surveyed us, said, I'm going to keep my children at home, and 50% said I need to send them back to school. And it could have been for a number of reasons. I'm a nurse. I'm a single mom. I have to go to work. I'm a whatever the excuse might have been. And then, there were other people like myself who, thank the Lord, had the resources. My husband works from home. I want to keep my child at home. I have a mother-in-law who has COPD. We can't afford to bring anything home in an asymptomatic carrier and get her sick, right? That's like literally life or death in my household. But it's different. And everybody was given a choice, and then the choice was taken away. So, honey, they picketed. They marched. You would have thought it was Black Lives all over again with these folks around
but it
here.
wasn't. Yeah.
It was like, get my children into school. I can't do this. Mentally, I can't keep them at home.
Right.
So they did. They turned it around. They started off the school year for the last 2 weeks. Everybody did digital, and now they're starting to bring the children. So today was actually the first day back for the kindergartners. I think kindergarten, first grade went back today. Next week, they'll bring back second and third. The week after that, they'll bring back. So they're bringing them in slowly. And me and my husband, we said it today. Child, we're going to sit back. Well, our children will be at home. We're going to sit back and see what happens.
Right. There's already all them positive cases when they... Yeah.
Girl, they done already shut down whole high schools. They done already shut down whole high schools in Georgia because of the cases. So we don't know what's going to happen. I do feel really, really bad for those situations where there are families that honestly, they don't really have a lot of wiggle room. They need to get their children back in school because that school was their childcare. Do you know what I mean? And they need their jobs. They need that flexibility or whatever the situation, their particular situations may be, which I don't hear anybody else talking about. I don't hear them talking about solutions for that.
Tell me about it, because there's no one size fits all solution. Girl. It's time for us to take a break. I'm Dr. Raina Gilmore, and you're listening to Interconnected, coming to you live from the BBM Global Network and TuneIn Radio. And when we come back, we're going to wrap up. Stay tuned.
Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant, like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic on the BBM Global Network, Tuesdays at 7 p.m. Eastern. Find your greater happiness. Be well. Be aware. Be magical. Dr. RC will share extraordinary resources and services that promote educational success, as well as making a difference in the lives of all social workers, as well as the lives of children, adolescents, and teens of today. She will have open discussions addressing many of the issues that we face about our youth and how being employed in the uniquely skilled profession of social work for over 18 years has taught invaluable lessons through her personal experiences. She will also provide real-life facts, examples, and personal stories that will confirm that why serving as a child advocate is extremely beneficial when addressing the needs of the whole child. Listen live Saturdays, 10 a.m. Eastern on the BBM Global Network and TuneIn Radio as Dr. RC will provide thought-provoking information that will empower, encourage, and strengthen students, families, and communities across our nation. You can also visit her at soarwithkatie.com.
Hey guys, I'm Dr. Raina Gilmore, and you're listening to Interconnected. We're on the BBM Global Network and TuneIn Radio. This evening, we've been talking about women's health, and I've had the pleasure of having special guest, my enlightened sister, Dr. Soyini Hawkins, who is a board-certified, fellowship-trained, minimally invasive gynecologic surgeon. I can say that real smooth now. And as we wrap up, I would like to say an inspirational quote. You are beautiful. Never forget that. In a world of 7.1 billion people, there is only one you. So take care of you because the world needs you. So that's my inspirational quote. And women around the world, I just added that at the end. So I have a question from a listener. Thank you so much for being on tonight. I know you're so busy and stuff, so thank you. Love you. Question from a listener. Who are your go-to music artists to keep you pushing through your full plate of life?
That's a good question. So I actually play music in my operating room, not like dance and act crazy, but I play
no twerking.
music.
You don't be twerking in the room.
No twerking in the operating room. No, ma'am. We're not falling for that. But I definitely love reggae music. So I'm Jamaican, so I listen to all things reggae in my operating room. My operating staff know the songs by heart now. So I'm going to sing ones over. But Egyptian is a reggae artist who's actually one of my favorites, and I like old school one is Luciana, and also, of course, Bob Marley. And then my new school reggae is like Rihanna, and Rihanna's a different vibe on reggae. She's like hip hop, and she has reggae tunes and beats and undertones to her music. So all things reggae.
All things reggae. I should have known. Now, Egyptian, you said, how do you spell that? Because I'm going to look it up.
Yeah, Egyptian. So Gyptian. Tian.
That's what I had. Okay, yes.
Yeah.
And Luciana, you said?
Good vibes. And Luciana, Luciano.
Oh, dang, Luciana. I had an A at the end of it. Okay. And I know about Rihanna, yes. Okay, and Bob Marley, of course. If you don't know Bob Marley, then something's wrong. Did you watch
Wake
that
up.
thing about who shot Bob Marley on Netflix?
Yeah, of course. My
Phenomenal.
daddy called me like, have you watched this?
Oh my God. What did you think? Did you like it? What did you think?
It's so, honestly, for a Jamaican, it's so controversial, right? Because there's so many
Okay.
conspiracy theories locked in it.
Mm-hmm.
And I grew up listening to all of those conspiracy theories. You know what I mean? Like the government and who was really responsible for this and that. So it's what I grew up. That story is what I grew up with.
Yeah, it was just interesting. I didn't know how political it was.
Very political.
Or how political they made it or whatever. Like you said, it is kind of tough, looking at that. My music artist, I would say, well, I've always loved Anita Baker, and my favorite group is In Vogue. But it just really kind of depends on what mood I'm in. Like, sometimes I want to listen to, something ratchet and raunchy, and go back to the like Luke and all that kind of stuff because I'm from Florida. Just to make me, because I want to feel like I'm in Florida because I'm not, and I miss it. But not the Corona Florida though. I'm not ready for that.
Right.
But recently I've been listening to Watercolors on XM radio, which is jazz. And I'm like, this is great. If I'm trying to focus, I'll just listen to like maybe some classical or just some instrumental type stuff or jazz, something that's I'm not going to sing along to. But I will put on that reggae, honey. Don't play. Okay? Because, that's like feel-good music. It's like feel-good music like at any given point in time,
It is.
So yeah. Well, we've come to the end. Thank you so much for being on the show tonight. I hope to have you on again. I had a really great time. Keep your head up. Stay balanced. Yes, stay balanced. And thank everybody for entering this journey of the mind, body, and spirit with me. I hope everyone has a great week. Stay encouraged and stay connected. Take care.
You've been listening to EnterConnected with Dr. Raina Gilmore. Join the conversation each week as Dr. Raina explores the mind, body, soul, and spirit connection. Take a journey that will lead you to a path of healing, learning, and how to cultivate and manage your life. Here on Dr. Raina's EnterConnected.
You've been listening to the BBM Global Network. The ideas, views, and opinions of this broadcast are those of the participants of the program and are not necessarily the ideas, views, and opinions of the BBM Global Network Company.